I'm John Hayden. Let's queer up trans rights. New York Attorney General orders New York City Hospital to restore gender-affirming care for trans youth. New York's Attorney General is ordering a major hospital to restart its care program, citing non-discrimination laws. Letitia James is directing NYU Langone Health to resume Transgender Youth Health Program, which the hospital ended last month. The Manhattan-based healthcare system ended the program weeks after Donald Trump threatened to revoke funding for hospitals providing gender-affirming care to minors. James' office sent the hospital a formal order which states trans youth are a protected class under state law. The AG's office warned that providing treatments such as puberty blockers or hormone therapy only to non-trans youth may violate New York's non-discrimination laws. The office also warns of possible further action if the hospital fails to comply, with a spokesperson saying, quote, "The sudden discontinuation of medically necessary trans health care can have severe negative health outcomes. The Attorney General is extremely concerned by your institution's decision to cease the provision of care to its vulnerable minority population," end quote. And my God, it's so great to have an Attorney General that's advocating for the LGBTQ plus community, especially the trans kids, because as we've seen on other stories here, other stories tonight, that our trans students are either being 100% oppressed or 100% uplifted. And it's just so crazy that we have to start making decisions based for our families, based on where we're going to live, who we're going to work for, where we're going to work. This is getting out of control, but thank God Letitia James is standing up. And by the way, she's the one who got Trump convicted on several dozen sexual assault, civil accounts.
Yeah.
He's a felon.
Yeah.
Because of her.
Trump's a felon. And those ain't getting pardoned. Those ain't getting pardoned because they're state crimes.
They're state, yeah.
That's some crazy. Listen, at the end of the day, healthcare discrimination is still discrimination, you know? I mean, come on. Like, my heart just breaks for those kids that have already started getting treatment, right? Are already beginning to feel, okay, this is going towards me being me, my true self, right?
Yeah.
And then you're going to stop treatment, you know what I mean? Like, thank God for Letitia, girl. I got you. All right. You are awesome. But I mean, this, you know, again, like, which way do we turn? Every single way we turn, we're being like thrown with some dagger. You know what I mean? And especially on Trans Day of Visibility Month, like, come on, like at every corner.
Yeah, and it's very much a partisan issue. I mean, that's the really sad thing, because it's a child, anyone's healthcare. Anyone's, but especially a child, and especially a trans child.
Yeah.
It should not be partisan political at all, because it should be about their well-being, their mental health, their physical health, and their desires.
Right. And hormone therapy is actually also used for non-trans kids as well. So there's that fine line of, you know, equality for everyone, and for what? Yeah. Revoking funding, you know, strong-arming New York into...
It's political. It's political.
Yeah.
Totally political.
California, the same thing has happened there.
Yeah.
It's insane. It's insane. We have to keep on fighting.
Well, there is no other queer nonprofit media platform like this in the entire world. Support our LGBTQ stories by sharing them and subscribing to Queer News Tonight.
Oof.